she is very, 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 very vocal and active on something called sin tax, especially when it comes to tobacco products. Karambu Muthaura, good morning. Good to have you here. Karibu sana.
Asante sana.
How we normally begin is welcoming our fixer guests to the show with the day's quote from Januama Quotes.
Januama Quotes.
So listen to the quote and tell us what's your reflection on it.
Yes. So the quote is by, he's somebody who was a Czech statesman. He was an author. He was a poet and playwright. And in many ways, he was an active citizen back then. He's called Václav Havel. And he once said, "The power of the powerless lies in living within the truth." The power of the powerless lies in living within the truth. What do you make of that? What do you understand by that?
When you refuse to be twisted with lies by those in power. So if you decide these are the stories they're telling us, for example, now during politics season, I'm going to deliver, I'm going to do what, and this is someone who has not done that in the past. So if you reject that, because the truth is he has never delivered, or this person has no capacity to lead. If you reject that, then you have the power not to have them. Leading you or in charge of you. So that's what I feel that could.
I think that's what it is. Yeah, it's standing in your truth, and hopefully when others do that, then it becomes like a groundswell of truth that pushes back. Okay.
So Karambu, you do a lot, right? You're an excise taxes expert, a health taxes consultant, and so on and so forth. And you have also been published in the opinion piece today, the Daily Nation, page 20, why every Kenyan must engage in budget process.
Yes.
You're not aware?
Today you're in the dailies and on TV and radio.
Everywhere.
You're doing well.
You're multimedia. You're multimedia. You're a fixer.
Thank
In
you.
this particular piece, you say that you participated in a forum last week with the National Treasury alongside civil society organizations under the Kenya Tobacco and Nicotine Tax Coalition, KTNTC, where the Kenya Tobacco and Nicotine Tax Coalition, led by the Kenya Tobacco Control and Health Promotion Alliance, another one, KETCA, and youth advocates, presented evidence-based proposals for the Finance Bill 2026. Now, before we even get into all those things, tell us about these organizations and what you've been doing.
Okay. There are so many civil society organizations, we call them CSOs, in Kenya that participate in tobacco control activities. So basically their work is ensuring that, because they can push, they can push through the activities. They can push the government to make adjustments in taxes, to increase taxes, to have regulations that prevent exposure of youth and children to these products, etc. Now, what has happened in the past is each organization has been working by themselves. So you'll find KETCA has done a research paper, NTA is doing a research paper. They're almost related, but if you don't have heavy funding, then your work is sort of, I'll not call it substandard, but you just have literature review, and you may not be able to go to the ground. So what the organizations did, and I'm glad that it's something I participated in, even though I did a bit of push for this to happen, even though I'm not a CSO myself. But as a consultant, it means that I work with them a lot. And sometimes they will consult me, can you please come? I go for their forums, etc. So in order to deal with that working in silos, they came together and formed a coalition so that when there's heavy research work to be done, they can do together. So then you are able to, and then when you're also going to Parliament, you're going to Treasury, you're speaking in one voice. I've not done my research using a certain method X, and then you have used the tax excise, a tobacco excise model, and then we are having speaking in different languages. So when we speak the same language, and I'm putting we because I'm doing the same work that they are doing, pushing for health tax, pushing for stronger taxes on not just tobacco, but products that harm you in some way if they are consumed in the way the manufacturer has manufactured them to be consumed. For example.
Okay, so that's the sin tax.
I will call it, I'll call it a health tax. Because when you look at it traditionally and call it a sin tax, then I'm talking about something being punitive to the person who is consuming the product. But in this case, we are collecting this tax so that...
From the manufacturer?
It's an indirect tax. So you might not necessarily say from the manufacturer. It's an indirect tax, just like VAT. So you have the ex-factory selling price, or when goods have come, CIF, and then you load excise duty, which now is a specific tax of 4,100 per meal. A meal is 1,000 sticks, and then 16% VAT. So now the excise component is what we are calling the health tax, because
careful not to say sin.
Careful.
When you finish, I want you. Sorry, I interrupt you. Because you're going to say.
Because these funds, we would expect them to be to ring light them or to earmark them for a specific use, which is supporting the health of the citizenry.
Great, teacher.
Yes.
Question. So, sin tax. And is it the name? Because from what I understand, the sin is punitive. And I think that's what I alluded to in the beginning when I was speaking to Eric, is around the word sin. Correct me if I'm wrong. Is that also what you're saying? Is it the same thing? Or you're saying, no, sin tax is different from health tax? Or is it just a better name or a better way to have the conversation?
It's a way you structure the policy. So that we are not having, when you're talking about sin tax, we are just saying, from here I can get enough money to add to the...
To run the budget.
To run the budget, you know? From here, if I increase 100 shillings here, I'm not even bothered that someone will not reach out to the... But I'll say if I add 100 shillings here, then I know in the whole budget, nitapata bilioni 20, you know, from adding this. Then in that case, because I'm just thinking revenue,
right?
You know,
okay.
So you're like, but you're consuming that product, so add to the revenue. But I'm not bothered about ensuring that the monies that have been collected will work in any way to better the healthcare or something else that it could be.
Okay.
So a sin tax is a collection of revenue. A health tax is ring-fenced towards health initiatives.
Yes.
Right?
Yes.
If we look at it now that way from policy view, the same way we are saying the betting, the sports fund, that cut levy is ring-fenced to go into this to support, you know,
advocacy around behavior,
and such. All right.
But in the same manner, when we are talking about in the same manner when we are talking about health tax and sin tax, we are still having something preventive. It's a preventive investment because I'm saying you're going to consume this product, and therefore pay this, which is sort of, call it a premium, so that when you get sick and all that.
Let's pause. Didn't look at the time. We're completely. We need to go into a break. We're in conversation with Karambu Muthaura, who's a health taxes consultant, and she's breaking down what that means. We're talking about sin taxes or smart policy. So sort of like that Kenya's health tax dilemma. It's coming up to 7:30. We'll be back in a moment and continue the conversation. And just before we get back into conversation with Karambu Muthaura around health tax, a few comments on YouTube. Francis Mio, Janet, please ask the guest if I can pay sin tax if I am saved. Nimechorea mambo za dunia. Then somebody else here, Sherman HQ says, if sin tax succeed in reducing consumption, how does the government plan to replace that lost revenue in the long run? Okay. I think we can leave it at those two for now as we get back into conversation.
Yeah, and as we're going to a break, we're talking about, what these taxes should be doing in terms of when you say, if the policy makers approach it from a health tax perspective, because you're saying it's the approach of policy. If policy makers approach it from a health tax perspective, then they'll be saying, we are collecting this money for a purpose. We are collecting this money from alcohol and alcoholic drinks, from tobacco products and so on, for a purpose. And the purpose would be health related. Yes. So it is addressing the concerns of those who are addicted into it and they have health concerns, and also addressing the non-start, non-initiation of the younger people into these habits to save their health in the future. Okay? Now, in this article, you say that when you presented this to the National Treasury, you told them about what they have not been doing right, or what they've been doing. Because if I read the article, you say, look, globally there has been a direction towards how you tax for these particular products, the excise for these particular products, and there's a rate at which, the percentage of retail to the rate of excise tax. You said that Kenya is still lower than the global standard.
Yes.
So Kenya's excise tax
global
is
standard
not...
doesn't mean that many people have met it. It just means that is what the countries who are signatories to the WHO Framework Convention on tax control, on tobacco control, are supposed to meet. So Article 6 of the FCTC, one of the tools that it gives for tobacco control is pricing, and you only increase prices of products. The tool you have as government to increase the prices of products is an indirect tax, and in this case, excise, because you can take a specific rate for a specific product. Yes.
Okay.
What does it say? What is this thing that not many countries have met, but they have signed up to at the WHO?
So what we can do, I think we can get it.
We can get that.
We can get that.
As we look for that, and as we come back to Eric's question, I think I'm trying to see whether there's evidence that supports that this actually shifts anything, right? Yeah. Does it actually reduce harmful consumption?
Yes, yes, it does. Yes, it does. So I'll give you a number of examples of countries, and one of them is Philippines. In 2012, Philippines introduced it's called they used the word sin tax policy, in which they increased excise taxes on alcohol and tobacco, and they took 80% of that into the universal health care. So just overnight, the poor had an insurance cover for
access to health care. But did it? Yeah.
So they took 80% of what they've collected from excise on tobacco and alcohol.
So first they increased
they increased the excise. By how much? Like by what percentage?
So that's the percentage I need to give you. Okay. But I'm just telling you that's one of the...
significant.
It was significant.
Okay.
It was significant. And then also we have South Africa with the sugar tax. Of course. So what it did for South Africa is that the manufacturers had to become innovative, because you're having an additional excise tax for anything that surpassed 4 grams per 100 ml. And therefore, they had to become creative and constitute. So now we're even making them to become. I'm speaking as if I'm in government.
Yeah, but no, I see what you mean. Too.
Yeah, when the government does that, then the industry also becomes innovative.
They take it seriously. Measurable impact. I know we are still coming back to what Latif asked are the numbers. You've just mentioned again around sugar tax.
Yes.
Any measurable impact to speak of so far?
So what you do there is then you have healthier people with less cases of diabetes, at least in children. Yeah, because those are the people you're trying to prevent from getting these illnesses. And then the other very good example, Mexico. Mexico has had a history of having high rates of obesity and diabetes. And one of the reasons, the main reason towards that is a drink, and I'm not fighting any beverage, is a drink called Coke. So Coca-Cola. So when you're thirsty, you ndio maji yao. You know, that was the, you move around, that's what is being carried.
Soda.
Yes, soda. But there's a specific joy about the poor being able to purchase a bottle of soda. And then even here you'll notice that soda is cheaper than bottled water.
Okay.
So what happened
in Mexico? Taxes were increased, and so a purchase of the product by the poor reduced by 11.7%. Yes, and so also cases of obesity and diabetes in younger children, and then even healthy adults when you change your lifestyle. And then the other thing is the substitution effect. So they started buying substitute beverages that do not attract excise duty, like bottled water, because in Mexico it does not attract excise duty.
Okay.
So then you see they're still purchasing beverages, but healthier beverages.
Okay.
Yeah.
In the studies, do they actually follow what number by number? Because you've talked about the percentage reduction in the purchase of bottled soda.
Yeah.
All right. Do we have, corresponding percentage reduction in cases of diabetes and so on and so forth? You talked about cases of obesity. Do we have percentage reduction that is directly correlated to this percentage reduction in the purchase of soda and consumption of soda?
Yes, they're there. Because there are many papers that have been published on each of those cases that I'm giving, including the UK.
Okay.
Yeah. So that's why I was saying what we have learned is that when that happens, the industry then becomes more innovative and they reformulate their products, especially beverages.
Okay.
Yeah.
So back into the case of Kenya, and now excise duty on cigarette and alcohol products. Let's start with alcohol products and then into tobacco products. It has been argued that increasing duty and taxes and levies on alcoholic products has actually led to a bigger proliferation of illicits and counterfeit products in the market, where over 60% of the alcoholic products that are consumed in Kenya are actually the contrabands. Counterfeit, illegal products, where the ones that actually contribute to even paying this tax just contribute less than 40% in the market. So the effect of raising tax is...
It breeds a whole other monster called illicit. Yeah.
And not necessarily a drop in consumption.
Okay. Now, I want to be very clear on something called when industry releases papers, especially when the government is using a tool to monitor them. Yeah? And not monitor, but maybe raise more revenue from them and also reduce the consumption of the product by the youth and children. what happens is that there are usually many different papers where when you get who did the study, who sponsored the study, industry. So basically, we'll publish the figures that we want. Okay? So imagine if Kenya actually had 58% illicit trade on tobacco. Did you see the results for BAT?
On tobacco? No, we're talking about it was alcohol.
No, I'm giving an example because they've given the same rates. Did you see the rates? Did you see the when they did there is no way you're going to have 58% illicit trade and get such figures.
Why not?
Terms.
Why not?
Because of the levels of consumption because of the proper levels of consumption, because there's also studies that show the consumption levels of tobacco and alcohol in the country. So if you look at that and then you look at what has been declared and taxes paid for, you will realize that there is no way. So you'll say maybe this is the gap that the government needs to collect taxes on, because where are they getting this product that they're consuming?
Are you saying there's no way illicit products?
No, there's illicit products.
Yes.
What I'm countering is when we talk about that the government is only collecting 40% of the taxes
of the potential.
of the potential. That is what that is what I am feeling, because
on the results of one,
not just one company, based on the results of all these companies.
All right.
Now, what I can do, Latif, because I do a lot of writing, especially on my LinkedIn, and maybe I could even blog, is that I could actually pick certain figures, and do a working and tell you, look at this, and tell me if it was possible for the government to be seated, people to be seated, and we're only collecting 40%. So I acknowledge that there's illicit trade, but there has always been illicit trade, even when excise duty was low levels.
Right.
Now, and we saw very strange ways of when because I have worked in the government, I have dealt with I have done what is it called, compliance checks on excise and other taxes. There were very many strange ways of illicit trade, including swapping, especially when the excise taxes are different, and there's no way of verifying. Like before, there was a track and trace system. So someone will say, we this month we had a big sale of, let's say, Rooster. That's what the community wanted.
Can I ask you?
And then they pay less taxes.
Are we focusing too much on taxation rather than programs that speak to prevention and education and?
No, we are not doing that. We are not doing that if we are actually following the health tax policy. Because what we are doing, these measures that we are taking by collecting health taxes. Now, that revenue, if it is properly earmarked towards health, then it's what will be used to work on the measures that, of course, that are timely right now on the burden of tobacco and nicotine use, especially nicotine use, even on children. Preventing non-communicable diseases, safeguarding young people, because we have education. And I said earlier that when you say that people will go to chew things, etc.
They will chew tobacco directly.
What do you do? What do you do when you are working on such measures? If you are doing things the correct way, you're supposed to go to the ground first and take certain measures, educate the people, help them transition. And I'll give a good example, like Migori, which is an area that tobacco is grown. WHO, together with the World Food Program, they worked and helped these farmers move to Nyota beans. Now, they were able to pay off their loans to the manufacturer, who they owed loans on seeds, fertilizer, everything.
And input.
Yeah, and they are left with food, and they're left with money that they can do other things that they are not being able to do. So you'll find a happier society doing that. So it's the same thing.
So the
You
health
prepare
approach is holistic.
It's holistic.
You're saying that let's first of all acknowledge that there is harm that comes from tobacco use.
Yes.
And especially the younger you are. And if you start early, then you...
And even your gender.
Yeah, even gender. So, and at the age you start, it's going to have longer lasting effect on you.
Yes.
So then the approach here is, first of all, to delay the age of onset.
Yes.
Right? To make sure that you are starting off at an age where you
you make sure delaying, it's not just delaying offset. When if you, it's very unlikely, if you don't start smoking by age 17, it's very unlikely. There are very few people. I only know one person who started smoking at 40. I don't know when.
That's interesting.
Yeah. So when you delay, when you do things that delay, they lose, and they're getting education on this. Then the
likelihood of them starting keeps dropping.
Yes.
As the older they get.
Yes.
And the more aware they become.
Yes.
Right.
Now what you deal with now is these alternative products that are coming.
Yes.
Yeah.
Which now is what is going to get these people into cigarettes later. You know? So you start using this because of the flavors, what. At some point you may not be able to afford this, but you need a nicotine kick. What do you do? That's when I met yes, so I met a 15-year-old who smokes 2 packs of Safari a day. That was crazy.
Yeah.
And I really felt sorry for them. And what happened is they have started smoking this at age 9. So it is not just a matter of the taxes. There's a lot of education.
So you're doing that. You're doing education. You're doing stopping. You're looking at the farmers that are growing this, because also in those farmer communities they also start smoking early because they have access.
And they get sick from even the chemicals.
Yeah.
So you look at that comes from tobacco leaves that is like malaria, and it's not. You know.
But all these measures are to be funded through the tax that comes from those that are consuming this product at present.
Yes.
Okay?
Yeah.
And so your proposal here, as I read it, is that let's increase excise tax on tobacco products to at least 70% of the retail price. 70%. So if we are selling we don't sell tobaccos in sticks anymore. It's in packets. If we're selling a packet...
But we are not selling. When someone is selling, the person selling, you're not selling.
Yeah.
But the law says you even that retail price you do not sell a packet.
You cannot.
Yeah.
The law says
you're not supposed to.
So let's go with the law. So if you're selling a packet of cigarettes at 10 bob, add another 7 bob, so it should be 17 bob now. If we go by this, right? If the retail price is 10 bob, Cigara equals 17, so that now the extra 7 shillings goes into this
health tax.
That is going.
It might be, because 70%. So it's 70% of 1700. It's 70% of 17.
Of 17.
Yes.
Right?
Yeah.
I've said the retail price is 10 bob.
The retail price is 10 bob.
Because you want 70% of the retail price.
Then that comes to how much?
So the tax. So you're saying, okay, I thought you were saying you are adding. Okay, that makes sense.
So
that makes sense. It's supposed to be
10
7 shillings.
Yes.
So 70% of that should be excise.
Yes.
Right.
So that's the 7 shillings.
So that's an extra 7 bob.
Yes.
So it becomes 17
So it becomes
shillings.
17 bob.
A packet.
No.
It would be how much?
So there's a difference. The price that is coming from the factory is the ex-factory selling price.
Yes.
Hiyo ndio unasema ni 10 bob. And then there's a price that Shop X on Luduli Street will sell the product. Now, that price is what is supposed to be, that is supposed to hold the 70% of...
within it.
Yes, so then you're supposed to, in that case then, you say... if they decide to sell the product at 17 shillings, then when we calculate, the excise duty is supposed to be 70%.
Okay.
Yeah. So it's not 70% of
added on to 10.
Of 10.
Okay.
Yeah.
Sour.
Yeah.
So,
But
so
whatever way, whichever case here, the push is let's increase the excise tax on tobacco products.
So you don't wake up and boom, so it's gradual.
Gradually, but let's increase it. And you say that then also let's ring-fence this money to go towards all these health-related campaign.
Campaign
including
and
putting some money
medication,
into primary health care.
Yes, in fact, for me, it's because we have this 15.4 gap in SHA. Then these funds should be able to cover. And when you calculate from the what are they called? From the proposals that have been there this year, you will notice that we'll actually be able to raise 18.4
billion,
which means we'll get share and surpass. Yeah. So I think this would just be the best way of doing that, especially because we've been dealing with healthcare through external financing, and people paying directly for their healthcare, and the government is supposed to take.
But these are other options.
So this is the better option. It's called domestic resource mobilization.
I want us to come back with you, because I want to think about the industry players who might push back and how much influence they have on these policies. I'm just hearing that other side of it. We're still in conversation with Karambu Muthaura, a health taxes consultant. We're talking about a policy, Kenya's health tax, and how that can be a solution to ensuring, delayed harmful habits, and how some of this money can go back to campaigns that promote healthy behavior. It's coming up to 8 a.m. We'll come back and continue the conversation. The government pledged justice for victims and support for affected families. Very unfortunate there.
Indeed. Our conversation continues on, taxes. We are in that budget season, and we are looking at proposals that have been taken by lobbies and tobacco control lobbies to the National Treasury, saying, let's increase excise duty and excise tax on tobacco products. Mike Njagi says, Latif and Janet, kindly let Ms. Muthaura know that these exorbitant sin taxes have led to a thriving counterfeit market for both liquor and especially cigarettes. How do we counter this? And she says, please give us more factual figures, right? Let's not just have over-the-top arguments here.
Yeah, numbers are critical. Data is critical.
Data
and I know
is critical.
People want data because it shows us what's working, it shows us what's not. And so, in fact, one of the questions I had is, compared to other East African countries, is Kenya overtaxing or aligning with regional policy? I think you touched on it by saying there's a global threshold which we can only compare with. Just before the break, I asked about industry players, because they also have influence over policy and trends, and it's kind of like straddling that line of, the fact that you're, quote unquote, coming for them, coming for their products. Talk to us about industry players, and then to speak to Mike Njagi, we'll see whether we can also just get some data on what's working and what's not. But let's speak to the industry players pushing back on the increases and how much influence they actually have on the policy.
When we talk about stakeholders presenting themselves and presenting their views to the government, we are talking about everyone. Every taxpayer, every citizen who, so if you have your research, you have your figures, you send to KRA or Treasury, and you've done your proper research, you have your figures, you what the fiscal effect will be, whether it's just going to affect policy and not the revenue collected, whether it's something that is going to affect things short term or long term. everybody is able to do that. Now, I have been before. I've been in the budget committee. Yeah, you know, I worked for the Revenue Authority for 18 years. Yeah, so and my last assignment, part of the stuff I was doing was I was in the National Budget Committee. So this time I was on the other side. Yeah. So when the stakeholders send their views and their recommendations to KRA or to Treasury, they read them. And then, of course, if there's no clarity or you don't know what someone is saying, of course you'll put that aside. You're not going to deal with that. And then you're left with not good proposals, with the proposals that you can understand whether you're going to accept them or not. And in most cases, if you have a question or you want to understand something further, you will call this taxpayer for meeting. You'll assign them their 30 minutes, like the way I was assigned together with the team the other day. And then go and we go through your recommendation and ask you questions. What? Maybe, okay, fine. Then you go and the team is left with it and they go through and then they agree on whether they're going to accept it.
Okay.
Or they're going to accept it with changes or they're going to reject it. Now, if they accept it with changes, they will, if they reject it, they notify you with the why.
What to do. So with the why, then maybe with recommendations on what would be acceptable.
Yes.
Okay.
Yes. So as a stakeholder, you'll be able to see whether your stuff was accepted or not. Now, the same way, CATCA and ILA walked into Treasury. Tobacco, whatever manufacturers can be able to walk into, is able to walk into Treasury and have similar moments. Yeah? And then Treasury is left with their recommendations and they will review them. That's the...
So it's quite a collaborative process. All stakeholders are involved.
Everybody does that. And so even when Treasury are making decisions, it's not just because Company X said, oh, if you do this, I may have to fire 10 employees. Treasury may look at the cost of firing those 10 employees. And what would be the opportunity cost of letting you stay with this so that you don't fire 10 employees and see, okay, let's just release those 10 employees. They can put their efforts. They can, because they are healthier employees, they can put their efforts somewhere. It's like saying, if you go to a manufacturing place which has poor ethics, all that, and you close it down, are we going to say, oh, now these people don't have jobs?
Yeah, it was, I don't know whether it's, again, I'm thinking about something that Eric asked earlier, and I don't know whether you feel like you've grasped, because I'm wondering what level of taxation works without driving people to illicit options. I know we talked about it earlier, but I'm just trying, again, I want to come back to that because it's always the counter to this kind of taxation. There must be a straddling where it's like, yes, taxation is important, but to what extent that it doesn't then drive an illicit economy, so to speak. Something to think about. Do you think these taxes are fair in the current economic climate?
Yes, I think they are, and the reason why I think they are fair is because if cigarettes increase, and so let's say the man of the house was smoking 3 packets, and now it's not affordable, he will start taking 1 packet so that the money for the 2 packets can go to the household. Now, in that case, then we have changed habits, you know?
Does that necessarily happen?
Yeah,
it does. It does.
We have to convince people that it does.
Yes, and that's why I'm saying a lot of the things that we are supposed to do when you deal with health taxes is these monies are supposed to be even part of educating the public, you know, and payment to the people at the lowest place in the dispensaries, you know, to be able to
access basic services.
Yeah, and not just that, that the CEO at a dispensary in a rural place is paid, is well trained to be able to talk to his patients and influence their habits, because we have enough medical workers in those places. Yeah. You see, some of these things, they're circular. Like if you don't have enough staff, employees, if you don't have funding for that, then at the same time, education will not get to these people. At the same time, you'll not be able to hire those people to help people change.
Is there enough funding?
Habits?
Is there enough funding for the data collection aspect of it? Because I can imagine a situation where and maybe the data exists, but if it's loud enough to say, this is, you alluded to it a little bit earlier. You spoke about sugar tax, you spoke about countries like Mexico.
Yes,
but I think even here, if there's enough data that supports, you know, the beginning of this is showing these results, or even these are best practices happening abroad and we think this aside can be used here, I think it can drive a bigger conversation.
Yes, I'll give you a small example of, this is my experience as a tax, I don't know to call myself a collector, as a project manager. But then, in 2014 to 2016, it's when we introduced the track and trace system on accessible products. A number of things happened. We changed the law, the excise law, from the Customs and Excise Act of 1970, whatever, and replaced it with the excise duties law of 2015 that came into effect on 1st December 2015. Now it allowed the Revenue Authority to introduce technology, you know, deal with modern practices. It simplified the language. And then when we are talking about how much influence do factories, business people have on Parliament and Treasury, it is, I'm sorry to say that some of the influence is influence that the Revenue Authority is not usually aware of. And therefore, something can come in the law. And how is this supposed to be implemented? You know, such things, because umeziona tu kwa tobacco, kwa the tax procedures of the Finance Act in June. And now you all start panicking, how are we going to implement this? But now on figures, when that happened in 2014, we made changes into the track and trace system, and our import on tobacco is usually very low on cigarettes, but the importers, a number of importers just changed their business, because of course you'll follow up and find out what they are doing. They've just stripped off the tobacco stuff in their supermarket. They're buying locally, so they're not doing that import, which they're still in business of the product, but we are not bringing in quite harmful product into the country. Now, excise taxes on imported tobacco at that point was up by 4,127%. They were small figures, but when you calculate the increase in 2014-15, that was the increase. The other thing is 2016, when we still pushed on track and trace, and then that's when the president was really harsh on illicit spirits. So KRA revoked all the licenses at once and told everybody reapply. These are the conditions.
Okay.
And then they had to work with the other government agencies. And that's something that I also need to speak about when we're talking about illicit trade. Working as multi-agency and working properly and having your systems integrated so that the government speaks in one voice.
Yeah.
The Ministry of Agriculture is promoting tobacco, or they are bringing income, and then Ministry of Health is like, oh, these tobacco leaves are killing, So everybody had to reapply for their excise license. Do you know how many people got licensed? From 187 licensees, compounders, only 23 qualified.
Out of the 187?
Yes.
Okay.
Only 23 got an excise license.
Okay.
Something else happened. Excise duty for that half year of 2016 rose by 8 billion shillings on spirits alone.
This was in 2016?
2016. What does that tell you? That this 164, of course, it was illicit trade.
One on pairs.
So there's like a vetting there that was able to...
And then even the 23, there was still illicit trade among them. Because, of course, they have taken the taxes that the others were paying, so they're paying them, plus 8 billion for that period. That will tell you that the most manufacturers participate in one form of illicit trade
or another.
Or another. Yeah.
So I think that everybody who hears these conversations and they hear, let's increase tax on a product that's consumed willingly and willfully by many, and then of course also it has the harm, they think, why are you making it more expensive?
Why are you punishing me and I don't have
why are you punishing me over it? And how do I know that this tax is going to be of any benefit to the larger population, as you argue, all right?
Yes.
So what needs to happen to make sure that even before we increase, that the Tobacco Control Act that says let's control tobacco use in the country is then matched with another proper and clearly defined and very well visible program that is discouraging children from consuming tobacco products or from being encouraged to smoke and so on and so forth.
Yes.
And then those that have been into tobacco control for years and they have now the health effects are getting the benefit from the health side. What needs to happen?
Yes. Now, apart from the health taxes, because this we are saying it should go to hospitals, it should go to certain programs, etc. Now, the Tobacco Control Act introduces something called the Tobacco Control Fund, and it's interesting because I'm actually working on a paper as a Kenya's a case study for the Tobacco Control Fund, how countries can be able to fund their own tobacco control programs, even like the CSOs, so that we stop every other day they're talking to what's their name? Bill Gates Foundation.
Looking for external donors.
We want to deal with something different. We want to deal with it differently. Now, when the Tobacco Control Act introduced that, it gave the Tobacco Control Board a mandate to be in charge of the Tobacco Control Fund, but also to collect funds into that fund that will be used for tobacco control activities only. And this is a good example of funds being picked and being ring-fenced for a specific
purpose or reason.
Purpose. Yeah. So this is a good example. So the board. So they said there'll be, apart from that, there'll be forfeitures, there'll be interest and fines, etc. And then there'll be also something called a solution fund, which is 2% of all tobacco manufactured for consumption in the country, and all tobacco imported for consumption in the country.
Okay.
Now, that is one of the reasons why BAT had gone to court from 2014 back 2019 when what are they called? When the Supreme Court said, no, this is okay. Because what you're doing, you're being told to fund the activities that controls the problems you're bringing.
All right.
And 2% is not a tax. It's a fee, you know? So now that fee, called the Solution Fund, Kenya just operationalized it in 2023.
Okay.
So what happened? There were no tools. That law, yeah. So now, luckily, it is about the same time before I left.
So as you sit today, Karambu, is this fund operational?
It's operational. That's what I wanted to tell you.
Does it have money?
KRA is collecting funds on behalf of MOH. Yeah. I know that 2023, 2024, there was 600 million collected in it. I know the allocation for the last financial year, and this financial year is about 820 million. The Tobacco Control Board for work. You know, I'm giving you that because it is those are figures that are in public, and then the OAG report.
So the first year 600 million, second year 800.
No, I'm not saying the second year there's collection of 800, and I'm saying I know the collections for 2020, 2023, 2024. I'm giving you the figures, that the information that is in public, because I'm working on a paper and I've not finalized my bit. When it's public, it should be public.
Okay.
Yeah. But so I know the figures that are in OAG and what BAT have put out in public, but what in their books. But what BAT do, they don't say this is excise tax, this is solution. They just put everything there, like this is excise.
But
this
the
is
board should be able to. I mean, the board is
the
collecting.
the board is collecting.
The
board is collecting.
Account.
No, I'm just telling you the way the figures that in public are not. Now, KRA is collecting these figures for MOH now and submitting, and of course at the levy, at the rate that they charge everyone else for agency collection. Yeah, so they have been submitting, and now that fund is being used for research. It's being used for those campaigns you're talking about, strictly tobacco control activities. Now, what needs to be done is things of how do CSOs, how do academia, etc. have access to that fund to be able to give us this
information.
Numbers.
Let's pause there and see whether we can continue this conversation and even invite the public, because I think there's something here. There's an education moment, but there's also there's just a lot of questions in terms of making sure that the data works and everything. We've been hosting Karambu Muthaura, health taxes consultant, talking about sin taxes, talking about health tax and the policy around that. We're going to come back after the break and talk about the Kisumu ruling, which we saw come out. Is police brutality on trial? We do have Executive Director of Amnesty International, Irungo Houghton. He'll be joining us in just a few moments to have that conversation. It's coming up to 8:30.